All right. Thank you guys for bearing with us. We just had a little technical issue. So I'm going to go ahead and turn over the presentation to Scott. Scott is part of the clinical team here at Kinetic Research, and he's going to kick off with AFO 101.
How's everyone doing? Thanks for joining us today. All right. So everyone, good morning, good afternoon, good evening. My name is Scott. I'm one of the staff clinicians here with Kinetic Research. Part of my job at Kinetic is really to consult both practitioners, physicians and therapists with device selection and really formulating a lot of the custom AFOs and devices that will apply to their issues and pathologies. So today I'm going to go over a little bit about the noodle AFO specifically and details about the noodle and how to pick between a prefabricated device and an actual custom device. Whoop. Very good. So when do we use a prefabricated noodle versus a custom noodle? So we have prefabricated, very, very simple design. You pick by measurement of the floor to calf. You pick the foot plate length and pretty much take it out of the bag and trim the foot plate if you need it. Very, very simple. Or custom from cast or scan. And with the scan right here, you see our robot is doing its job, working. So when do I use a prefabricated device? So prefabricated devices, no range of motion issues. Patient can be corrected or can achieve to correct to 90. Having a very typical anatomical shape is always easy because we don't have to deal with irregular calf circumferences. We'll always get a quicker turnaround time. Normally, if you order a prefabricated device, it will most likely be sent out that day versus, let's say, if you were to order a custom, which could take 7 to 10 days, depending on any add-ons, anything like that. Noodle's excellent choice for a prefab. Noodle is excellent choice for drop foot. And if you look to that slide on the right, you see how that noodle pre-positions the ankle at 90 to help with swing clearance and also helps out with a little inversion of the foot, keeps everything nice and straight, subtalar neutral. Excellent choice for hospital visits, in and outpatient therapy, home fittings, especially if you have limited tools. Not everyone has a Troutman in the back of their car or a grinder in their vehicle, so they can go ahead and trim with surgical scissors. And that is actually something I'm going to bring up with our Nano product. Excellent choice for fit kits, handy in the office or on the go. We do have a fit kit. You can pick between and I'll go over these styles in a second. You can pick between the Noodle Hemi-Spiral or Noodle Classic or even a TA Noodle, which is our anterior product. So what side do I place my strut on? Most commonly asked questions. We do offer medial and lateral. So which side would you place this strut on? And some people can answer that. So in this case, it looks like the patient is supinating. So what would make sense is to put the strut on the medial side so that they don't crash into the strut on the lateral side, which may cause skin breakdown and issues. Which side would you place this strut on? Medial or lateral? This patient has pronation issues, low arches, so we would want to use a lateral strut. They would crash into the medial strut, again, causing issues and possible breakdown. So when not to use prefabricated? So we look at the patient, we can look at a bunch of different factors. We can look at height, weight, and activity level to start out. Any visual contractures or fixed deformities, Any of your bariatric patients, fluctuating edema, atrophy, small calf circumference. Sometimes the prefabricated cuffs are sized to a specific size and can't make the full wraparound to meet the anatomy. So you're not really getting an intimate fit. Sometimes you can actually bell clap within that. So what are things you can do? Most people will put in extra padding and whatnot. Anatomical irregularities or any bony anomalies that we have to offload or give relief to. So which style do I use? Well, we have three styles. We have a noodle classic. So our noodle classic, the OG noodle, as we call it, is the more flexible noodle by design. So this particular device, if you see that top left picture, it's going to flex in the line of progression. So really what it's doing is it's loading and unloading. It's storing and releasing energy. Its cuff by design has more flexibility to it. So if you do have a patient that does have any fluctuating edema and needs a little bit of extra relief there, this would be a more ideal approach as far as the cuff or design. Medial or lateral strut, you can choose. The foot plate is flat, shaped to fit a 3/8 heel height. And you can see that bottom left picture, flat 3/8 rise. Occasionally what you can get with this is bridging within the shoe because every shoe last is different and heel heights can vary. So I will go over that on how to accommodate for changes in heel height. Next is our hemispiral noodle. So this particular noodle is the more durable option. Again, by design, it's the way the cuff actually enters into the strut enters into the cuff and how it enters into the foot plate. So this design is a spiral design, which actually provides more rotational support and motion. So it's giving off a coiling effect, different than the noodle classic, which is more of a load-unload. The hemispiral will coil and uncoil. Much stiffer cuff. One side of the cuff is a little bit stiffer, the other side is more flexible. So it's someone that has, again, a larger calf or someone that fluctuates in edema. This may not be the most optimal choice, but it can, it may very well work for them. Again, medial or lateral strut, also a flat foot plate, standard 3/8 rise, standing at 90. And then we have our anterior TA noodle. Great off-the-shelf device for providing ground force reaction, stabilizing the knee. Ideal for crouch gait. Device flexes in the line of progression, very, very similar to the noodle classic. Easier for donning and doffing, especially for a heavier patient that has trouble bending over to actually find where their shoe is. So this would be an ideal approach of actually entering in through the posterior side. And again, a medial or lateral strut. And you can see in this photo right here, this video, the flexibility of the design. And now I'm going to jump into our nano products. So I'm going to stick with the anterior version because I left off with the anterior TA noodle. Talk to you about the nano. So the nano is just an excellent solution for ground force reactions. We incorporated 2 extra degrees of plantar flexion, and it's also a slightly stiffer product than the actual TA noodle. And show you so right there you see it's a little bit stiffer. So if you need more of a posterior directed force or a little more control of the knee, this would probably be a more ideal device for that. Easy again for donning and doffing because of the anterior shell. Comes in a medial or lateral design. And we also, on the strut, we now position that a slightly more posterior on the foot plate to allow for an increased ankle clearance. Makes it also easier to fit into the shoe, and it sits nicer in the heel counter. Again, with that being said, we actually rounded the heel of the nano so that we can accommodate a more athletic type shoe. Also fits better. Gives the heel a forced position, so it sits nicer in that, doesn't create anterior posterior shifting, and creates a little bit more of ML stability. Wade did mention earlier that you could add an inlay to it to cover that carbon. Because, what we want to do is we do want to add a protective barrier between our skin and the device. So it's always important to have something in between that. Now, if the shoe has a slightly thinner inlay, that's acceptable. If you're looking to add a custom insert or even a shaped prefabricated insert, probably not the best idea to use that in conjunction with a nano foot plate, only because it's got a slight contour to it and things won't sit properly. So if you're going to use any kind of custom or prefabricated insert, it would be best to use it with our noodle flat foot plate, our standard foot plate. Again, we talked about force positioning with the heel. Again, keeps everything nice and stable inside, makes it a lot more comfortable, a lot more intimate fitting. We also use a very minimal layup on this. So even though the strut is going to have its integrity that we categorize it with, you're going to have more of a flexible cuff, and the foot plate is easily trimmable. And you can see, as far as flexibility goes, here's our posterior nano, and you can see up in the right-hand corner, and you can see we can cut that with a pair of surgical scissors right on the fly. Extremely easy. We don't have to use any machinery for that, and we can fit it right into the shoe, walk the patient, get immediate results. So basically, the posterior nano was designed to fit, again, all the contours of an athletic shoe. Very easy and trimmable foot plate. It's going to be more comfortable with a more intimate feel, minimal carbon layup, creates a lighter weight, increased fit and flexibility. It's going to always position the foot for swing phase, position the ankle at 90 degrees. And again, it comes in a medial or lateral design. So some of the add-ons that you can do with your prefabricated devices, if let's say you weren't going to go custom, but just needed some small biomechanical changes, we can always add wedging. So even though our devices are built on a 3/8 rise, sometimes we need to actually make that stand into footwear that won't accept that to stand at 90. So what we want to do is maybe add a heel wedge, so you can use a harder foam for that. So if you needed increased dorsiflexion, you can add that to the heel portion. If you wanted to increase more plantar flexion angle or possibly increase ground reaction forces, you can add that wedging to the forefoot. And it increases ML stability. So we can also add a pretibial shell, and all of our pretibial shells are removable. We do not fasten them. So removes easily with Velcro, increases comfort for the user, increases proprioception, and creates a little ground force reaction. So if, let's say, there was a patient that could not use an anterior product due to, let's say, anterior issues with their shin, or couldn't have any type of total contact with that, but needed some type of a ground reaction, you could actually add a pretibial shell with a posterior device and have that device put into, let's say, plantar flexion. So still increasing ground force with lighter contact on the anterior surface. And then we can always add a T-strap. And of course, the T-strap increases your ML stability and correction. So then when do I use custom from cast or a scan? So if you have issues with range of motion, not everyone can get the range they need, so we're going to have to accommodate that, and sometimes we need to add a lift or bring the earth up to the heel or wherever the foot is. Height and weight, it's a big factor. Some people are heavier than others, and that need more support with the device. Sometimes our prefabricated models can't hold that weight specification. So when I have our customers call in, our practitioners, they always ask, hey, does this particular device, will this prefabricated device hold? So I kind of have to talk them through it, see the activity level, see the height and weight of the patient, see where they're at. Do they use any type of ambulatory devices? And we put that all together. Hypertrophy and atrophy. Does the patient fluctuate in volume, or are they completely decreased in volume? That's going to be a big factor. And then we can customize the cuff to intimately fit the patient, so we can control better range of motion and have better proprioception, no bell clapping, keep everything intact. Also, if you have rigid deformities and contractures, we need to accommodate those things, because the prefabricated devices are built at 90 on a 3/8 rise. Not everyone sits at 90, so we have to accommodate that angle again. So fixed deformities, a triple arthrodesis set in 10 degrees of plantar flexion. We have to build a device that'll accommodate that in that fixed position where it's lying in space, and we have to bring the earth up to that area, and this way we can get a nice flowing gait. Anatomical misshape, bowing. Sometimes a noodle strut won't accept that bowing of the tibia and needs to curve with it in order to move in that line of progression. Another good reason to use custom. And then categorizing the strut and foot plate based on the patient's activity level. So do we want the foot plate stiff or flexible? Do we want to increase or decrease resistance? What are we trying to achieve? Do we want to control knee hyperextension, equinovarus with foot drop, and recurvatum with 2 degrees to CVA? Secondary to CVA. Something that Keith had mentioned, something that Wade had mentioned earlier, is that, you look at your R1 and R2 limitations. With the R2 limitations, we see how far we can get to the